Hello everyone. Today's topic is diffusion capacity of lung. Diffusion capacity of lung of a gas is the volume of the gas that passes across the respiratory membrane in 1 minute per millimeter mercury difference in partial pressure of the gas on the two sides of the respiratory membrane. This is definition. This diffusion capacity measures gas diffusion from alveolar air to pulmonary blood and vice versa. It measures how fast oxygen or carbon dioxide diffuses between the alveoli and pulmonary vessels. When when diffusion capacity of a gas is more, it will diffuse rapidly. What is the normal? Normal range for oxygen diffusion is 25 milliliter. It is expressed in milliliter per minute per millimeter of mercury. Partial pressure difference across the cell membrane, across the respiratory membrane. Oxygen diffusion capacity is 25 milliliter per minute per millimeter mercury, partial pressure difference across the respiratory membrane. And for carbon dioxide, it is 20 times. It is 20 times that of oxygen. That is 20 into 25 milliliter. That is about 500 milliliter per minute per millimeter of mercury, partial pressure difference across the respiratory membrane. Therefore, when there is some disease of respiratory membrane, then diffusion of oxygen reduces, but diffusion of carbon dioxide with more diffusion capacity is not hampered, not reduced to a large extent. This is about definition and normal value of diffusion capacity. Diffusion occurs. What is diffusion? Diffusion is a process in which molecules move across the along with or down to the concentration gradient. Diffusion is a process in which molecules moves down to concentration gradient and or down to electrical gradient. This is diffusion and it is a passive process. Here also, when in alveoli, oxygen partial pressure or oxygen concentration is more in the alveolar air, in the alveoli, and blood passing through this here oxygen concentration is less and partial pressure is also reduced. Therefore, oxygen will diffuse to the pulmonary blood. Oxygen will diffuse to the pulmonary blood. And what happens with carbon dioxide? Carbon dioxide CO2 content is more in pulmonary vessels, pulmonary capillaries, and here in alveolar air its concentration is low and partial pressure is also low. Then it will go into the carbon dioxide will move to the alveolar air. This is about diffusion capacity of lung. What are the indications? What are the indications of doing or measuring this diffusion capacity. Indications are: number one, pulmonary. It is a part of pulmonary function test. It is part of pulmonary function test. Number two, diagnosis and diagnosis of lung diseases, pulmonary diseases, lung diseases, and monitoring. Third is monitoring of treatment of lung diseases. Then determine the severity of obstructive as well as restrictive lung diseases. Number 5, to assess health of lung, or you say respiratory capacity during or before surgery or in athletes. To assess health of lung. These are the indications why we try to know, why we measure this diffusion capacity. This diffusion capacity depends on age. In young age, around 20 years, it is maximum. Then position. Age, then position. In lying down position, diffusion capacity is less. Then surface area. Surface area of respiratory membrane, alveolar respiratory membrane, membrane. Normal average is, it is 80 meter square. It may reduce in some diseases, for example, fibrosis. Surface area of respiratory membrane. Then thickness of respiratory membrane. Normal is 0.5 micron. Normal is 0.5 microns. It may become thick. Then fourth is distance. Distance to cross the gas. So that diffusion may occur. Then fifth, solubility of gas. These are the factors on which depends diffusion capacity depends upon age, position, then surface area, thickness, distance to cross the gas, and solubility of the gas. So diffusion capacity is capacity is directly proportional to surface area and solubility of the gas. Of the gas. And it is inversely proportional to number one, thickness of respiratory membrane and two, the square root of molecular weight of the gas. High diffusion is normally 25. High diffusion capacity is not typical. It is seen in number one, asthma, seen in asthma, then polycythemia vera, and right to left shunt in heart. High diffusion capacity. Low diffusion capacity is seen in anemia, restrictive lung disease, lung diseases, for example emphysema, then anemia, restrictive lung diseases, obstructive lung disease, in all these conditions, or primary pulmonary hypertension, primary vascular diseases, in all those conditions, diffusion capacity is reduced. So this is about diffusion capacity of lung. Thank you very much for watching. Please like and share this video and subscribe the channel. Thank you very much.